Hello, hello. Hello, hello. Good morning, good afternoon. Come on in, come on in. We're having a live with Whitman-Walker Health Clinic today, so come on in. Come on in, come on in. Good morning, good morning. How's everybody doing this afternoon, evening, almost? Yeah, it's pretty much evening, people. Hope everybody's well. The weekend is almost here. Hello, hello, hello. How's everybody doing? We have a special guest today, so we're just waiting for them to come on in so we can talk today. No worries, take your time, Chad. Let me see if I can add you. It says unable to join for Whitman-Walker. Maybe close it and come back in. Hello, hello. Yeah, it says unable to join. I haven't tried to add or accept yet. Hi everyone, join in, join in. We're trying to have a live today. I'll let you guys know in a few. Just waiting on our guest for the day. How's everyone's Thursday going? Hello, hello. Oh, good to see you guys. Long time. Let's see. Hello, hello. How's everyone doing? Sorry, guys. Having a couple technical difficulties. Just trying to get our guest on today. Give me a little time. Hello, hello. Hope everybody's doing well. Don't forget we're having our Whitman-Walker chat live today about body dysmorphia. Just waiting for our guest to join in. Hello, hello. Hi, Rama. So give us a minute. Come on in. Tell me how your Thursday is going. Thank you for all the waves, all the waves. I'm not sure if the system is going messed up for Whitman-Walker. Well, how's everybody doing? You guys ready for the weekend? I love you all too. I love you, Christian. Let's see. Sorry guys, today's live has to be with two people because it's more of a Q&A. I have the Q's, but not the A's. If not, I would give you both. Hope everybody's doing good. Let's wait a couple minutes and see if we can get him in. October, people, it's October. Gracias, gracias, trato. I try. What are you guys up to? Give me some questions, guys. Don't forget to follow Whitman-Walker on Instagram, Facebook, and Twitter for any information on testing, STIs, HIV, and COVID as well. So if you know you want to get tested or you feel like you might have symptoms, please call them first to make an appointment. They are open now to be able to test. Just make sure and get the right information to them so they can make sure and keep everyone safe. Thank you, Brendan. What a day. Y'all see I'm a mess today. I look a mess. Long day. Still not over. Hello, hello. Sorry, guys. Join in, join in. We'll have a Whitman-Walker live today talking about body dysmorphia. We have a special guest today who will give me some info on a new project. No worries. Thank you, guys. I saw him already on here. Just he was not letting him in. No rush. There's no rush. We have plenty of time. Hope everybody's doing well, staying safe, social distancing, washing your hands, sanitizing your hands, not touching your mask too much. Stay safe, guys. It's getting crazy. It's crazy out there these days. What's everybody up to? Nobody's told me what they're up to. Let's see. A lot of my staff on here. Keep them hands clean. That's right. Ain't that the truth? Oh, yeah. I started mixing like aloe hand sanitizer with like some scent. So it's a little softer and it smells good. Don't forget, everyone, wash your hands, wear your mask, stay safe, stay distanced. Hello, hello. Hey, Dr. Jones. Just waiting on our guest, so bear with me, you all. Hello, hello, hello. Seeing a lot of people on here today. Good to see you all. What are you guys up to? Any questions? Any questions from me? If you have any questions for Whitman-Walker, don't forget to hit them up. Follow them on social media. Oh, I think I have a question. Let's see. Yes, Whitman-Walker Health does testing. So make sure you call their offices. Let me get that number for you. It's 202-797-4439. You can ask about HIV testing, STI testing, and also COVID resources and testing. So make sure. I think we might have our guest here. No, not yet. All right. If you have questions for Whitman-Walker, don't forget to add them on social media, and we'll go from there. Just hang out with me, guys. I'm just waiting for my guest today, so hope everybody's staying safe and being super, super, super careful out there, staying safe. If you are out, make sure you protect yourself, wash your hands, wear your mask, you know the deal. How's everybody being treated these days? You guys being good, staying safe? Sorry guys, we're still waiting for our guests, so bear with me so they can tell you a little bit about what today's topic is about. It was so warm today, oh man. I told you this weather's holding off for my birthday on Monday. I need to have a nice weekend to just not have to be wearing a coat. But yes, for those of you joining in, this is my normal Thursday Lives with Whitman-Walker today. We're talking about body dysmorphia with a special project we got going on. So hopefully our guests will come on soon so they can tell you a little bit more about that. So bear with me just a little bit. Keep telling me how everybody's doing. How's it? Where are you viewing from? From? I know somebody's from Paraguay. I see that. Thank you for joining. Mm-mm-mm. So for those of you who don't remember, oh, Philadelphia. Thank you, Omar. So good to see you. For those who don't remember, wash your hands, hand sanitizers, have it with you at all times. You know I do. I have like 5 gallons. Bachata brunch is in the house. Hello, hello, hello. Wear your mask. We talked about this last week. Your masks are super important. Don't touch them around here. Always grab them from these strings and make sure you wash or sanitize your hands before and after. You don't want any germs getting on your face or anywhere near your mask, which is what's supposed to be protecting you. Keep your distance, wash your hands, stay safe. I know some of you will be out and about, but just be very, very careful. Hello, hello, hello. Hey, how you guys doing? Got the couple in the chat. Sorry for the hold up, guys. We're just waiting on our guest from Whitman-Walker to join in. I think we're having some technical difficulties. But hey, you're hanging out with me. And I know you guys are already over being on computers and online because that's all we're doing now for work. So thank you for choosing me if you are watching. I'll let you guys know how's it going once our guest is able to join us. Mm-mm. Mm-mm. So don't forget that Whitman-Walker is open for HIV STI testing by appointment at our Liz location on the corner of 14th Street and R. To make an appointment, I'll give you the number. It's 202-797-4439. There's also testing at the Max Robinson Center in Anacostia, Monday and Wednesday afternoons. All right? But social distancing is a way to reduce the amount of COVID-19 transmissions. So it deliberately increases the physical space between people to avoid spreading the illness. All right, so you know the deal, guys. Stay at least 6 feet away. Wear your mask in public. Avoid places with large crowds. Encouraging work from home if possible. Speaking with loved ones over the phone, FaceTime, instead of in person. And well, you already know about social distancing, as caring for your community is super important. So guys, tell me how you guys have been practicing social distancing. What are you guys up to? What's your favorite thing to do to keep your mental health up to par? What do you like to do as a hobby? Put them in the chat so I can read them out. Share something with someone new because maybe that'll be super helpful for someone who never even thought about it. Long drives. Oh yeah, long drives are super fun and super stress relievers. Went out to an outdoor garden. That sounds fun. Some clean air, get to walk outside, especially with this weather. Breathing exercises, meditation. Can't even read. Meditation. Oh yeah, meditation is always super helpful. Breathing exercises. Hello, hello, hello. Okay, I think we have my guest. Let's see. They are here. Let's see if it works. Hey, hey, how you guys doing? Oh, we have Tyson's TSR. Thanks for joining. All
Hi.
right. Hello, how are you?
Oh my goodness. Technical craziness. It's
I'm
just kind of
sorry.
that's okay. It's okay. That's kind of how life is right now. Is like
It
if my day
is.
doesn't have some sort of technical trauma, then it hasn't been a full day. So
Exactly. I totally feel you. I'm over here like trying to talk about things. I'm like, I can't even talk about this project because Chad has all the information.
I do. I'm sorry. I keep everybody waiting or
Not a
waiting.
worry. Well, thank you for joining.
Yeah.
Well, for those of you that don't know, I am Orlando. My pronouns are he, him, and his. Pretty much, I work with Whitman-Walker as a social media influencer. During these past few months, Whitman-Walker Health Community Department has expanded its outreach efforts on social media, covering various topics about HIV, STI, health practices, access to care, social detriments of health in general public, health interventions. Our series of outreach sessions focus on the pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. So today we have a special guest, Chad Wheeler from the Whitman-Walker Behavioral Health Team, who has really exciting new program he wanted to share with us. So
Hmm.
everyone make sure, ask questions, join in the chat. We are totally here looking and ready. So Chad, you want to introduce yourself?
Sure. My name is Chad Wheeler, and I'm one of the behavioral health specialists at Whitman-Walker. So I'm a licensed clinical social worker, and I've been in the biz for quite a while now. And working at Whitman-Walker was really kind of when I started this work, where I wanted to, what kind of the dream was. And so this group and some of the stuff that we're going to talk about today, hopefully, is some of that stuff coming to life. So.
Well, thank you for joining us today. Sorry for all the hassle to get in here with us, but
That's
but you're
okay.
here. All right, well, let's get started. The first question I have, you just answered your role at the Women Walker Health.
Hmm.
So tell us again exactly your role.
Yeah, I'll tell you a little bit about what being a behavioral health specialist means. It means that we do a whole bunch of stuff. We're also kind of the liaison between the medical staff at Women Walker. So if they have a patient who is expressing some concern for mental health or interested in something along the lines of behavioral health care, then they can refer over to us. And then behavioral health specialists do a consult where we kind of see what the individual is looking for and give them some information about everything that we have at Whitman-Walker and also what's available in the community. And then we get to do some individual therapy with a certain caseload of clients and run groups where we see the need identified in like a larger group of people. And then we also work with the trans population in getting the necessary letters that are needed right now for gender affirming surgeries. So we do a lot of stuff. It's a great job.
Oh, we definitely appreciate you. Thank you for doing all that for us and for our community. So the next question I have is, what is this new Man in the Mirror program all about?
Well, this is a group for disordered eating or eating disorders, body dysmorphia, or body image concerns. We have had a group for just over a year now that was initially run by myself and Jen Bindeman around eating disorders for the LGBTQIA community. It was a very popular group. And like I said, we kind of start to identify if the group gets too big that we might need to split it so that we can really pay attention to our clients. But we wanted to kind of address if there was a population that was particularly high. And what was kind of determined is that for gay men, there is a strong population, or at least what we're seeing is a lot of gay men that are dealing with disordered eating, body dysmorphia, body image um, concerns, and there isn't a lot of treatment out there. Like if you're somebody that is dealing with an eating disorder and you're a gay identified male, there's not a lot of things that are available in treatment, really for men in general. And there's also problems within the trans community, but this seems to be really predominant and pervasive within the gay male community. And most of the literature right now is kind of talking to the cisgendered female more than anybody else. So we're trying to get a group together that can really address this and have a space where people can really feel safe and comfortable talking about some tough issues.
Okay. And what challenges do specifically gay men experience with eating disorders?
Well, I mean, and that goes a long way. That this has been a specified population because there is something that was in it within gay culture that isn't talked about too much, or maybe it is, as far as the focus on appearance and a lot of the things that have to do with image and feeling kind of important or feeling a part of means having to look a certain way. And that can get really dangerous if that's, we're all made differently and we all, all of the way we were made is beautiful. But if we're all shooting for one thing, there could be some problems along the way. And there's also the thought that really for any gay person or trans person or any kind of marginalized person as they're growing up, being identified or bullied or anything along those lines can be very traumatic. So this is kind of taking a look at some of those things, and how they may have played a part in kind of behaviors that people are noticing in themselves.
Okay. And who can join Men in the Mirror? Is it open to everyone?
Well, like I said, we do have the other group for if you are in the LGBTQIA community. There is Jen Bindeman's group, which is the same premise, the same idea, but just kind of a more all-inclusive group. And then as far as my group specifically, it's anybody who is gay identified. So anybody that is identified that they are a gay male is welcome in the group. And even in as far as the assessment, like even if you're having some question, because such sexuality is such a spectrum, and there are things that, as far as there's an interview process of kind of assessing where you are with kinds of things that could be disordered eating, and those would be things that would be assessed as well. So if you're questioning whether you qualify because of a sexuality piece, then, we can definitely do an interview and talk about the level of comfortability and those types of things. As far as kind of heterosexual people right now, that's kind of a population that there is a lot of treatment out for people that are identifying as cisgendered heterosexual folks. That's kind of where most treatment is out there. So we would absolutely help anybody that got in contact us with, regardless of any of those things, to connect them to services, even if it's not with us.
Right, okay. And how do me specifically, or for anyone watching, join Men in the Mirror?
So you can just go to Whitman-Walker's website, which I'm sure people put up or whatever the case may be, and go to the behavioral health section. You can email me directly. It has in the behavioral health area all of us, or most of us, as far as the therapists that are involved, and direct links to be able to email them. And you can also, there it has our phone number, it has all of those things. We would set up a little bit of time to just talk, which isn't any, it's not charged to your insurance or anything along those lines. It's just kind of to see if this is right for you. And if it is, we get you started and introduced to the group. We have some great guys that are in there now doing some really great work.
Oh, that's awesome to hear. So his information is in the chat, guys. So if you look in the comments, take a little picture of that so you have his phone number and email. And so, Chad, tell me, are you a part of any other program either related to eating disorders or just related to behavioral health in general?
Well, yeah, that's the good thing about the way Whitman-Walker works is that we kind of identify the needs, and with the licensing, we have kind of a broad, and we have a great opportunity for education. So, yeah, the groups are not the ones that I'm involved with. There is a grief and loss group that is ongoing for people that have experienced a loss and everything that goes along with that. Also, understanding your use. We have a fantastic addictions program at Whitman-Walker. We have both an abstinence base, which is Whitman-Walker Addiction Services, known as WAS, and then also harm reduction groups, which is a different approach to recovery. And understanding your use is kind of talking about all of that as far as everything that's out there and available to you when you're thinking that maybe there might be a problem in some area, that addiction might be a concern for you. And it's a safe place to be able to start to talk about what you think you might need. Do you need treatment? Can we help you? Or is it not the right time? All of that's okay.
Well, that's awesome. Thank you so much for all that information. You
Yeah.
have anything else you want to add in there or let us know?
Anybody that's is a behavioral health specialist, when you see on the behavioral health page, we can link you to any of our services. Sometimes there is a really great need, and if we aren't able to serve you, we can kind of put you on a wait list and connect you to people that can see you right now. But we can do a pretty much anything that's in the behavioral health category. We can link you to if you want to reach out to any of the folks on the website.
Beautiful, beautiful, beautiful. Thank you. So, I mean, does anyone have any questions? Let's see if we have any questions or comments. We have a lot of hellos, hellos, hellos. We were
So
talking about what people are doing to keep sane at home. So they were giving us a couple options to share with everyone. No specific questions. Well, don't forget, Whitman-Walker is open for HIV and STI testing by appointments at our Liz location on the corner of 14th and R. To make an appointment, you can call 202-797-4439. We are also doing testing at the Max Robinson Center in Anacostia, Mondays and Wednesdays afternoons. Social distancing is always a way to reduce the amount of COVID transmissions if it deliberately increases the physical space between people to avoid spreading the illness. It involves, you know, the rules, staying 6 feet away from people when possible, wearing your mask in public, avoiding large places with large crowds, encouraging work from home if possible, speaking with loved ones on FaceTime, phone instead of in person, social distancing, of course. Don't forget to just keep everybody away. That's super important. Remember to wash your hands for at least 20 seconds at a time, 6 feet apart, wear your mask, stay home, and don't forget to follow Whitman-Walker on Twitter, Instagram, and Facebook at Whitman-Walker, or their sister pages as well, Real Talk DC _. And to stay up to date, go to the Whitman-Walker website. Well, Chad, it was a pleasure meeting you.
it
Anything
was.
else you want to mention before we go?
No, I just want to say, like I was saying, if there's any category of this is a really rough time, like you were saying, Orlando. So if you feel like you need a little extra support, there's no shame in that, and that's what we're here to do. So feel free to reach out, and um, thanks so much, Orlando, for doing this and for being patient with my technical.
Not a problem. That's the one thing I have, patience. Well, thanks, Chad. We'll see you soon, and thanks for
Okay,
joining us. Bye, everyone. See you
bye.
soon.